Good day in your health with Bellin. How to reduce your risk of heart disease this month.
Yeah, it is Heart Month, and cardiologist Sumit Ringwala is here. Good morning to you.
Good morning.
Okay, let's talk a little bit about why it's so important to start talking about heart disease, even if you haven't developed it.
So really, when you think about heart disease, it's a process that starts when you're a little kid. You start getting stuff that goes into the walls of your arteries from when you were a little baby. And it goes all the way through an adulthood, and then when you're having a heart attack, that's actually the end result of it. So if you're thinking about what to do, you should really be changing your diet, exercise, and lifestyle from when you're a child so that you get good habits, and that translates to you not having a heart attack in the future.
Sure.
Let's talk about some of those specific lifestyle changes we can make to improve our heart health.
So a lot of times people are like, should I exercise? Should I diet? What are the things that we can do? The things that I really think are important are actually diet first, and then exercise at least, half hour to 40 minutes a day, and then reduce stress. Those are the three main things.
Let's start with nutrition. And before we get to, we made up some bullet points of things you should do with vegetables. But before we get to that, let's talk about the two top diets that are recommended for heart health.
So a lot of times people come to my office and are like, Doc, what's the best diet? Because I see the Atkins diet, I see the keto diet, I see all these diets. They've actually done research and shown that the two diets that are the most likely to reduce your chance of strokes and heart attacks are, number one, the Dean Ornish diet, and number two, the Mediterranean diet.
And that first one is what? It's more like a whole
It's a
food?
whole food plant-based diet. So that means eating lots and lots of fruits and vegetables. What I tell my patients is live in the produce aisle.
Good advice for everyone. Well, let's talk about some of those tips that we have with the vegetables specifically.
So when you're looking at fruits and vegetables, you can go and get any type of fruit, any type of vegetable. You can get sweet potatoes, anything that looks like it was growing on a stalk or in a plant. That's going to be the best for you. And you can either there are these air fryers that you can take like the different vegetables, slice them in half, and just stick them in there, and then put some salt and pepper, and go to town. The other thing that you can do is have any types of fruits, and whole fruits are really the keys. Whole grains, if you're going to eat grains, and then legumes for your protein.
Okay. Let's talk a little bit about some of the other foods we should focus on and whether drinking matters, what we drink as well.
So drinking alcohol, the current guidelines say 1 drink if you're a woman and 2 drinks maximum if you're a guy. And you should do it occasionally, not every single day.
Yeah.
As far as other foods, water is super important. It's not a food, but a lot of times we're like, what can I drink? They're like, can I drink Diet Cokes, regular Cokes? They're all bad for you. So the thing that really you got to take into consideration is that water is the best thing for you, and you can drink as much of it. Unless you have heart failure, you can drink as much of it as you want.
You mentioned exercise plays a role.
Yes.
How do we add that in?
So what I try to tell my patients is at least a half hour a day, and by the time you're done, you should be tired. And so if you're going to walk fast until you're tired at the end. If you're going to do, any of these online things, you can do whatever you do, but be tired at the end of it, and it should be cardiovascular exercise, and then weights and stuff can also play in.
Thank you for this practical advice, honestly. We hear so much about heart disease and how to reduce it, and this was really practical advice. And if you'd like to learn more, head to heart.org or head to bellin.org, click on the Heart and Vascular team, and then click on Patient Resources.
Great advice. Thank you, Doctor.
Thank you.
You're welcome.